As Cigna Healthcare's National Dental Director, Dr. Deborah Fuller leads the development and enhancement of clinical integration programs aimed at improving customers' whole person health. She leverages her expertise within the dental profession, including private practice and community dentistry, to oversee the Cigna Dental Quality Management Program, serving as a clinical expert with clients and assisting in clinical policy development. Julie Kozak is the U.S. National Business Development and Retention Managing Director for Cigna Dental. In her role, Julie has responsibility for the dental and vision client strategy and business development for 11 million Cigna dental customers. In addition to co-managing the Cigna Healthcare dental distribution sales and retention team, Julie donates her time to provide Spanish translation services for 2 local women's health centers to help educate the Hispanic population on area healthcare wellness initiatives on prenatal care and oral health. We're really excited today to welcome these 2 amazing women to join us for the final forum session and share with us the impact of oral health on overall health. Welcome, Deborah and Julie.
Thank you.
Thank you. All right. So I'm Deb Fuller. I've been a dentist for, gosh, almost about 30 years, and I'll be the proud mom in May of a dentist and a nurse. So I'm really excited to share the things that I've learned over my career on oral health and overall health, but specifically talking about women's oral health and why we're special and unique.
Thanks,
Julie?
Dr. Deb. And I'm Julie Kozak, and I have the pleasure and honor of working with Dr. Deb over the last few years. And my background has essentially been in dental product distribution for 30 years. So I'm excited to be here and co-hosting this meeting with Dr. Deb. So let's jump right in with that. So women's oral health. Dr. Deb, what is oral health? And more importantly, what makes it really important for women's oral health, and how is it unique to us as women?
I could talk about this for an hour alone, just because I'm just so passionate about dentistry, about oral health, and really what it is, and educating people about things you may just not be aware of. And everything I've learned, I didn't know when I went into dental school and learned it along the way. But oral health in general is just more than the health of your teeth and the gums. It's, your jawbone, your head, your neck, your throat. There's a lot to it. And this man is just really one of my idols. And this is Dr. David Satcher, who was the Surgeon General about 25 years ago. And he really was the first one to shine the spotlight on oral health, kind of putting the mouth back into the body. And I'm not going to read that, but I've highlighted what really oral health is. It's sort of like the check engine light. It's a window to the rest of the body. It really does show signs and symptoms of other conditions, disorders, diseases. So it's more than just our ability to smile, chew, and interact with one another. It really is part of the body, part of our physical health, our vitality, behavioral health, and physical. So talking about oral health, I've got to first kind of take a step back and let you know, let's talk about oral disease. What is dental disease, oral disease? And first, I'm going to start with gum disease. And as I'm going to be talking later through the morning and afternoon, everything will kind of fit together. So I just wanted to do really just a real high overview of what gum disease is, Julie. And it's a very prevalent, it's an infectious disease. And I've included some photos and some x-rays because I really think it's important for us as individuals, as women, to see what a dentist is looking for and what kind of gives us the telltale signs if there's something not quite right going on. So what gum disease is, it's an infectious disease, and there's bacteria in our mouths, about 800 different species of bacteria, and they kind of live in the plaque. That's that sticky stuff that kind of forms after we eat. And if we don't brush off that plaque, then those bacteria cause our body to react to them. The bacteria go underneath the gums, that plaque can harden into tartar, calculus we call it, and our body kind of fights that infection. And in doing so, unfortunately, it attacks the structures that are supporting the teeth and the gums. So there's a kind of a cartoon that shows the stages of gum disease from gingivitis all the way to periodontitis. We lose the support around our teeth, and we lose the bone that holds our teeth in there. You can see in that x-ray on that molar, on the right side of it, you can see that dark area. It's pretty obvious that there's bone loss.
Yeah.
So there is a progression of disease. Gum disease isn't really the only oral disease that we as adults have to worry about, but it's also tooth decay. Oh, and I spelled dental wrong. Sorry about that. Dental decay is also called dental caries, and it's something that even adults, we've got to worry about. And it's also another infectious disease caused by different bacteria. So if we eat something, sugar, carbohydrates, the different bacteria will take that sugar and carbs and produce an acid. And if that acid isn't brushed away, then the acid can start to wear away the enamel of our teeth, and a cavity starts to form. And you can see the progression in that cartoon of it's starting on the outer part of the tooth, and kind of an infection isn't stopped, will go into the center of the tooth, infect the dental pulp, and then potentially cause a dental abscess. That could lead to pain, abscess, swelling, infection, root canal, and that whole thing. So I really want to talk about really the threats to our oral health. And these two diseases are really something that we as adults have to worry about and be concerned about as we age. Here are some photographs of what tooth decay looks like. That upper right-hand one, that's a child who's probably about, oh gosh, I don't know, 8 to 10, and I've got arrows where the decay is starting, and then some on adult teeth, arrows pointing to it. Sometimes it's very obvious, and sometimes it's very, very subtle. Really take care of ourselves and making sure that we're going to the dentist so we can get this taken care of. I want to jump back, Julie, to what you asked about what regarding women's oral health is unique. And it really has to do with our changing hormones throughout our life cycle, from puberty all the way through menopause. And it's those different levels of estrogen and progesterone that makes us have an increased risk for those oral diseases at certain times of our lives. If we have medical conditions, say if we have diabetes or heart disease, that also increases our risk for gum disease, for example, and vice versa. So really, our overall oral health really is tied to our overall physical health in so many ways. And I'll talk about it a little bit more in greater detail.
This is great that you shared it. Having personally experienced this with my second child, I had pre-gestational diabetes, and my dentist recommended that I get in for more visits. And what was alarming to me is I had no idea of that connection to potential preterm birth. So it was something that for me was enlightening. And being that diabetes also runs in my family, it also kind of gave me that wake up moment to understand how that was a precursor and one of the early warning signs later on, which also had another personal experience by going to my dentist when she said, when was the last time you had a physical and your sugar checked? Because she actually thought I was pregnant. And at that time, that was not a possibility. But in fact, sure enough, after my physical a month later, my sugar levels were elevated and I made some lifestyle changes. So I appreciate you mentioning how it's all connected, because these are things just from your simple dental visit that we can discover. When we think about this, there's different stages of life within a woman's life. Any thoughts around, when we think about, as a mom of a daughter, starting with puberty, are there things that we should be concerned about and talking to our children about?
Mm-hmm. Absolutely. This is where the hormonal changes are starting. That's the reason for puberty. So there are a lot of oral health impacts around this stage of our child's life. Gingivitis and periodontal problems, estrogen, progesterone, they're going up and down, they're changing. So it changes what's going on in the oral environment. So it does increase someone's risk for gum disease, tooth decay. As I said, it's something that is throughout our entire lives. Tooth decay is the most common chronic disease of childhood. It's more common than diabetes and more common than asthma. When a young girl starts going into puberty, dietary changes. She may not be brushing and flossing as well as she could. Diet is very, very important. Constant snacking, especially on sugar sweetened beverages, sports drinks, if she's an athlete, soft sodas, juices. So the diet might be changing, not really quite under mom and dad's sights all the time when she goes to school or out with her friends. So the dietary issues change. And also tooth damage. Unfortunately, there might be eating disorders coming around at this time. Doing some, bad habits, chewing ice, chewing on pencils or pens, piercings. So there are so many things that are going on at this particular time of our lives. And menstruation, numerous ways that, starting your period and having your period affects your oral health. And, it's definitely as with anything in our lives and our bodies. One woman could have a different experience than another woman. In general, a few days before our period starts, estrogen and progesterone are increased, and it's preparing the uterus for implantation of an egg and fertilization. So this hormonal peak may cause our gums to become more swollen, more sensitive, bleeding, irritated when we're brushing and flossing. So making sure that right around this time frame of the month, oral hygiene is really good. A soft toothbrush that you're brushing and flossing, making sure that if you do have a teenage daughter, or a younger girl that's going through puberty, that she's taking care of her oral hygiene as well. So very, very important. Even if the gums are starting to bleed and puffy, keep doing the oral hygiene to keep that inflammation at bay.
Great advice and enlightening, certainly, I'm sure, for some moms out there. So as we kind of move on to the childbearing years, and we know that a lot of women, as we start to plan things, start to plan for a family, what should we be concerned about? Should we be doing different things?
Mm-hmm. Yep, absolutely. I think the first thing that I think about in the childbearing years is taking birth control, specifically hormonal birth control, such as birth control pills, the shot, vaginal ring, hormonal IUDs. Those contain hormones, and you can see which hormones are in what. And that really does impact what's going on in our mouths, how much saliva, how good our saliva is at sort of neutralizing that acid I talked about that causes tooth decay. Bacteria levels may change. So there's a lot going on. So unfortunately, the birth control does impact our oral health. So if you are on any hormonal birth control, just make sure you tell your dentist. He or she does need to know what medications that you're on, and that includes anything that's implanted, oral medications, and depending on, if you have an infection going on, your dentist does need to know that. So some of the things that we do prescribe may make the birth control less effective. And also hormonal birth controls may impact how well we heal, say, after a dental extraction, for example. So after any type of dental extraction, there's a clot that forms, and sometimes if that clot falls out, which is a risk factor for all these hormonal meds, you might get a dry socket. And you probably have heard that term when it talks about root canals. It's painful. It's basically the clot coming out of the socket, and that area, the bone is exposed, and it hurts. I had one when I had my wisdom teeth removed when I was in dental school, actually, and it hurts. So just, again, inform your dentist whatever medications you're taking, even birth control. We need to know. I think also in the childbearing years, if we're planning on becoming pregnant, I have read research that untreated gum disease is associated with increased time to conception. So it really might impact your fertility. And in general, I want to say that gum disease, as I said, it's an infection caused by bacteria, and that bacteria causes inflammation. The bacteria can get in our bloodstream, and the inflammation can occur, and it could have some impacts around the body. So really making sure, if you're thinking about trying to get pregnant, really make sure that you're going to the dentist. If you have signs of gum disease, get that treated. If you have any untreated tooth decay, caries, get that treated as well. So as you're planning and you're going through all the prenatal preparations, don't forget about your dental health.
Would you say that it's just important to go to the dentist during that pregnancy time as it is to go to your physician?
Absolutely. Going to the dentist is absolutely part of good prenatal care. And you just mentioned it, Julie, that you were talking about, gestational diabetes and gum disease. So there are things that happen during pregnancy, and again, because of the hormone changes that impact our oral health. So it does increase our risk for pregnancy gingivitis, which is that first stage of gum disease, and also gum disease itself. And you can get a pregnancy tumor, which is called a pyogenic granuloma, very, very common, 10%. And it's just like a puffy area of the gums, could be on the gums, tongue, cheek. It's very temporary, it's very benign, and it usually goes away after delivery. Also, if you've ever had morning sickness, I don't know if you did, but I did, and as you're vomiting and you're having morning sickness, that stomach acid going into your mouth could wear down your enamel. So if that happens, rinsing with baking soda and water, don't brush right away. So there's a lot of things that are going on during pregnancy. And hopefully, GYNs and OB-GYNs will be asking, when have you gone to the dentist? When was your last visit? Are you going? Because you really want to make sure that everything orally is healthy, and you don't have any untreated disease. Here's a picture of everything I just talked about. There's a pregnancy tumor, pregnancy granuloma. Again, very common, nothing to worry about. It will go away, may bleed a little bit, but you can see pregnancy gingivitis. If you look at the upper left-hand photo, the gums right around the teeth look red. It might bleed a little bit. The upper right-hand one, maybe a little bit puffier. So again, going to the dentist, making sure that you're really practicing good oral hygiene, that you're taking that time. There's so many things going on while we're pregnant, but making sure that you're taking care of your mouth as rest of the body.
Well, we certainly go through seasons of life, and the next season that, at least personally for me, I'm in the throes of it, menopause. What about that lovely season of life for us women? And oral health.
And oral health, yep, been there. Before I go on to menopause, I do want to mention untreated, and you already mentioned it, Julie. Untreated gum disease, it really does increase a woman's risk for delivering a preterm or low birth weight baby. There's a lot of research. It's not, if you have untreated gum disease, yes, you will have, a low birth weight baby, but it's one of those risk factors of all the other things that are going on. So, making sure that, you're getting your gums checked, you're going to the dentist, as you talked about, gestational diabetes, making sure that, you're, you're brushing, you're treating all that. So that'll help prevent diabetes. Now, so I get asked all the time, is it safe for me to go to the dentist while I'm pregnant? I forgot to go beforehand. I didn't have time. I didn't know. It's absolutely safe to go when you're pregnant. We dentists, we know what we can do, what we should do, what can be delayed until after mom delivers her baby. X-rays are safe. We want to make sure that there's no untreated infection. But I think many women may not go for a variety of reasons. Fear, they don't know it's safe. Prenatal providers, they should be asking if you're going, but sometimes, this was decades ago, there was a lot of fear on the part of the OB-GYNs. There were fears, around the dentist. Oh, you're pregnant. I don't want to see you until you deliver. Well, science has shown absolutely safe. So just make sure that, that the dental work, going to the dentist is part of your prenatal care.
Fantastic.
Yeah, and this too, this is really interesting, and I didn't know about this, again, until I went to dental school. So I talked about cavities, the bacteria that cause cavity is an infection. So mom delivers, that fantastic. Everyone's excited. There's so much going on. You're learning how to take care of your new infant who does not come with an instruction manual. But dental should be, again, top of the mind. So those bacteria that cause dental cavities, babies aren't born with them. So how do they get them? They get them primarily from the mom, because we're around the child the most. A pacifier might fall on the floor, we pick it up, lick it off and stick it in the baby's mouth, or we may try food to see if it's too hot, pass the baby the spoon. Kissing, any way that you can share saliva, you're passing those bacteria to the baby. Could be mom, it could be grandma, it could be dad. So really, if someone if mom, again, didn't have the chance to go or didn't know she should go to the dentist before or during pregnancy and has some untreated cavities, most likely she's got a lot of those decay-causing bacteria. So there's a greater chance of passing those bacteria on to the baby. Mom's diet, very important, limiting carbs and limiting sugars and all that. So that picture of the little baby, I've been using that picture for probably 25 years. The baby, I'm having the bottle and the hand in the mouth, mom's mouth. Bottle comes out. Where's that hand going to go?
Yep.
Right in the baby's mouth. So,
Yep.
It's just really important to kind of limit that. And, as soon as, the baby, eats, no teeth, doesn't matter. Wipe out the gums, with a soft washcloth. That cleans out everything, whether it's breast milk or formula, and gets the baby used to mom or dad going in there with something other than a breast or a bottle. So when the teeth do erupt, go in there with a soft toothbrush, and you're not going to have that much resistance for brushing. And also, this is, I wouldn't say fairly new, but child's dental visit should be within 6 months of that first tooth popping in, or no later than 1 year old. And when I was in practice, I worked, and I really miss it. I worked in an infant and toddler clinic where I saw kids birth through their 3rd birthday. And the youngest child I've ever seen with tooth decay was a 7-month-old. So as soon as, the poor little nugget had 4 teeth and 2 of them started to decay. And we stopped it. It was a lot of diet and feeding practices, and we stopped the decay. So it's really important. 3 is definitely too late. So the earlier, the better.
Yeah. So there's definitely something to be said about not putting a baby down with a bottle. So it's what I'm hearing there.
Yep,
or the 5-minute binky rule, probably not a good idea.
Yeah, the 5-second rule.
5-second rule. Yeah.
Putting the baby to bed with a bottle with anything other than water in it increases the child's risk, what we call early childhood caries. So that picture I showed you of that 10-month-old, that was the reason for that tooth decay. And that 7-month-old with cavities. Bottle to bed at nap time.
Gotcha. Such great advice, and seems so logical, so avoidable. So things that we can do to be preventative in nature.
Mm-hmm.
Thank you. So on to the next season of life then.
Menopause.
Yep.
So again, it's the changes in hormones. I feel like, kind of a broken record. It's all hormonal changes. So we're losing estrogen around menopause, and that does lead to a whole bunch of things. Again, our gums might be more inflamed. Burning mouth syndrome. I don't know if anybody's ever experienced that, but it's very annoying and very painful. Dry mouth. So sometimes the amount of saliva is decreased due to the decreased estrogen. We might have changes in the way things taste or smell. Just some gum recession. So there's a lot of things that are going on, but there's a lot of things that we can do to kind of help with it. Water, absolutely. Using a humidifier in the bedroom at night. Due to the reduction of saliva, you might need a saliva substitute. It could be something over the counter that you could get at your local CVS or Walgreens, or it could be a prescription medication that your dentist can prescribe. Diet, I think, is really important as we age. I talked about in puberty, dietary changes, those sports drinks, sticky things, sodas, energy drinks. It's also very important, kind of on the other end of the spectrum, that we want to avoid anything that's drying, such as alcohol, tobacco use, again, avoiding sticky foods. You know, if you have a reduction of saliva or burning mouth syndrome, you definitely don't want to eat anything salty or spicy, because that's just not going to be comfortable. Yeah. So, and again, talking to your dentist, talking to your physician about any signs or symptoms. Is there, or do you notice any changes in the way things are tasting? Do you notice any, any changes during swallowing? So just kind of noticing what's going on in your body at all these different times of our life. And if there anything is unusual, or, talk to somebody about it.
Yep. So clearly, as females, we have a lot of awareness around, oral health from hormonal changes. And this is all fantastic information, but are there other underlying conditions or things that we should be concerned about as women outside of hormonal issues and oral health?
Yep, unfortunately, yes. There are actually over 200 medical conditions that have signs or symptoms in our mouths. You had mentioned going to your dentist, and she was saying, when's the last time you had a physical, getting your sugar checked? Diabetes, there's so much research on the interrelationship of oral health, especially gum disease, and diabetes. So periodontal disease, for example, increases the risk for not being able to control blood sugar. And conversely, poorly controlled blood sugar increases our risk for gum disease. I remember, gosh, this was probably 27 years ago. I was in residency, and I had a patient. We placed a dental implant, and I kept bringing him back and bringing him back. I'm like, wow, why isn't this dental implant healing? And then I asked him, I said, all right, do you happen to be diabetic? And he's like, no. And I go, why don't you just go to your primary care doc, have him check you out, do some blood work. Well, he was an undiagnosed diabetic. And that was why, the implant delayed healing is one of the, unfortunately, one of the symptoms, the signs of diabetes. Wound healing is delayed. We placed this implant, it looked beautiful, but it just never healed. So diabetes is something that we have to worry about. Eating disorders, it affects both females primarily, but also males. Vomiting, purging, that stomach acid coming back up can erode the enamel of our teeth. Also, if you have an eating disorder, you're not getting the right nutrition, the right nutrients. So that could impact on the support around your teeth and your bones. Heart disease, it's still the #1 killer in the United States and globally, women especially. So, if you have valvular problems, heart valve problems, and untreated gum disease, that is a risk factor. The bacteria in the plaque and the gum disease can travel because your gums bleed. So the bacteria can enter the bloodstream, and that the bacteria can travel to damaged areas of the heart. It could, atherosclerosis, which is the kind of the narrowing of arteries. Oral bacteria have been found in the arterial plaques in atherosclerosis. So significant correlation with poor oral health. Stress, anxiety. Dentists have been seeing so many more cases of cracked teeth, TMJ problems, grinding teeth since the pandemic, and it's still continuing. So behavioral health conditions, anxiety, depression, stress. If we are taking medication, that could cause dry mouth, increase our risk. So there's so much of a connection between behavioral health, substance abuse, and oral health. Autoimmune conditions. Women are more likely than men to suffer from an autoimmune condition. It could be rheumatoid arthritis. It could be Sjogren's syndrome, which is a cause of dry mucous membranes. Eyes, our mouth, vaginal tissues tend to be drier. And again, it's a chronic immune condition. So these are just a handful of chronic overall health conditions that are associated with poor oral health. I could talk about Alzheimer's and dementia, chronic kidney disease. There are so many. So not paying attention to what's going on in the rest of our body, making sure that you're managing your chronic condition, getting in for those screenings and those checkups and in your annual blood work. and talking to your dentist about any condition, general medical condition, or behavioral health condition that you have will really help the dentist kind of plan a specific treatment plan and plan prevention for you.
Thank you, Dr. Deb. This is, I know when we started looking at these correlations years ago, it was just the obvious ones, expectant moms and diabetes, but so much research has been done, and I really appreciate you bringing light to the connection with cardiovascular disease, and then to your point, a lot of these autoimmune conditions, and then certainly most importantly, kind of that behavioral tie with stress and anxiety. Let's talk about dental anxiety for a moment. So on my side of the world, as I work with clients, one of the things that we hear is we have these great benefits and we still have folks that it's 100% covered and they don't go to the dentist. I personally love going to the dentist, but my spouse doesn't. Here he married a lady that's in dental product land for 30 years and he has high dental anxiety. And as his wife for years, I kind of teased him a little bit, but then as I learned, it is very much a challenge for individuals. So any thoughts around that and things that we can do for those that we may know have a real concern with their anxiety and how we can be empathetic and help them through that so that they can have a positive experience at the dentist?
Dental anxiety is, I think I went over, there we go, sorry. I think dental anxiety, dental phobia is so real. And the, more folks that I talk to, just, meeting someone in the line at the grocery store or going out, for a cocktail, a glass of wine and sitting at the bar, just chatting with people. And my husband, now, because he's a dentist as well, he doesn't like anybody to know like that he's a dentist, that I'm a dentist. He's like, oh, we're going to hear the stories. And I said, it's great to listen to people and just say, okay, so why are you afraid? And what happened? And a lot of it, unfortunately, does stem from a bad experience at childhood. So that's why I said getting children into the dentist very, very early. They'll be used to it. They won't have the dental problems because they'll be prevented, and getting dental fluoride and sealants, and having mom and dad and grandma and grandpa being educated on how to prevent dental disease. And going to the dentist, it'll be fun, and you get a toy, and it's so different, I think, now than it used to be back in the day. I've heard so many folks say that, oh, when I was younger, I had teeth taken out with no Novocaine, and the dentist was mean. And dentistry is so different now. Pain management is so different. But going to the dentist, besides you, Julie, I don't know anybody who likes to go. Really,
love it.
Because we're laying you back. It's a very vulnerable physical position, being laid back in a dental chair. The dentist is right there. You can't see what we're doing. You can feel what we're doing, but there's sights and smells, and there's so many things. We're right in your personal space. And that's why I wanted to show everybody, what gum disease looks like, what an x-ray looks like, what tooth decay looks like, because as a patient, you can't see really what we're seeing. And, hands in our mouths, we can't talk. We're talking probably at you, not with you. So it's a lot. It's very, very different than going to, your primary care doctor, where you're looking at them eye to eye, and you can see what they're doing, and you can ask questions. So dental anxiety is, it's very, very real. And I think besides the convenience factor, like a lot of us, we're all working women. We're taking care of spouses, children, maybe aging parents, or community members and volunteers. So that convenience factor, that's one whole set of challenges. But I think, the fear in dental anxiety, is the second big one. And as women, like I said, we're busy. We can't take time off from work. We're taking care of other people. We might be afraid of, we haven't been in a while, or, oh my gosh, what's the dentist going to find? Are they going to be judgmental? Trying to find somebody who you're very comfortable with, I think, is the first step in kind of overcoming dental anxiety. All my medical providers are all female. I just feel very comfortable going to a female gynecologist, going to a female PCP. So maybe for some women, going to a female dentist will take some of that anxiety down. Bringing somebody with you, bringing headphones, Some dentists actually use virtual reality goggles to kind of distract you. But I think a lot of it has to do with communication. Going in, finding a new dentist, for example, and just going into the office and meeting them and say, hey, I'm a little bit afraid, I've got some anxiety because X, Y, or Z. And having that conversation before you're sitting in a dental chair, I think is really important. I actually, when I was in practice, I worked a lot with individuals with special needs, many children on the autism spectrum. And there might have been a few visits before I can even get them into the operatory because of fear and the sensory issues. So communication, I think, is huge. Agree, say to a stop signal, even if it's during an exam, if you're very, very anxious, raise your hand. That's all right. Let me take a couple of deep breaths. We'll continue. Having the dentist, you may like the dentist explaining, okay, I'm going to do this because of this, then I'm going to move on to this. Some other people don't want to know what's going on. So again, building a relationship with a dentist, with a provider, I think is huge, and that really will overcome some of the fear and anxiety. There are medications. Yeah, so I mean, if some of these like behavioral relaxation techniques don't work, there's there's oral medication, there's sedation. Those come with risk. So I think the communication and more relaxation techniques, a great way to start.
Thank you for that. I'm proud to say that my husband has graduated to non-medicated dental visits, and he found a provider that I think he used every single one of these techniques, most certainly the stop technique, and he had to know exactly what was going on at every moment. But to your point, he did his research and found a really, really patient practice. And now he does not reschedule his appointments. He actually follows through with them, and he's compliant, which is great. So that there's hope. So thank you for that. Thank you so much, Dr. Deb. This was all so enlightening. Any questions through chat that we may take?
Yeah, while we're waiting for questions to come in, and I think with anything, it's prevention. It's being taught, is being knowledgeable about how can I prevent cardiovascular disease, how can I prevent diabetes, how can I prevent gum disease. So a lot of it is just I think a lot of it is lifestyle. I say maintain oral overall health. So if you do have a chronic medical condition, making sure that you're keeping your blood sugar under control, that you're taking your medications, and just being aware. I think as women, we're very in tune with our bodies. If something doesn't feel right or look right, I think we're very just aware, and we'll seek care and talk to a provider about it. I think it's great now in the age of telehealth, we can have a virtual conversation with our provider, whether it could be our dentist, it could be a primary care doc, or another doc through MD Live or some other telehealth, to get questions answered, to identify something early, and bring it to a provider's attention. We talked about visiting your dentist. So, for example, some individual with gum disease, they can go twice a year. The dentist may recommend 3 times or 4 times a year. Just being really compliant with those visits, both medical and dental. Good oral hygiene, brushing for 2 minutes 2 times a day. 2 minutes is a lot. If you ever tried to, put your timer on your smartphone. I get asked a lot, electric toothbrush versus manual. And I used to say, it doesn't matter, whatever you would like. But I'm really a convert to electric toothbrushes because they have the apps and they have a timer, and they can tell you if you missed over here or you didn't spend enough time over here. If you are a heavy brusher, the brush won't let you push that hard. Especially if you've got dexterity problems as you're aging or may have some arthritis, those are great. Avoiding soda, even diet soda, because there's acid in diet soda. Sports drinks, the acidity, the sugar content, juices, and again, limiting alcohol, and really not using any tobacco products. Just kind of those general well-being health habits.
Great.
Well, I want to thank you, Deborah and Julie, for a really enlightening discussion on the impact of oral health on overall health. I know most of us think about going to the dentist twice a year to get our teeth cleaned and probably don't think much more beyond that. So you have given us some really insightful medical advice about how we can address a lot of other health issues that we face, and particularly at different stages of life. And since we, are dealing with multi-generational workforces now, and as represented among our attendees today, it's important to know what can happen to your teeth and your overall health at many different stages of life. That may very well coincide with many different stages of our careers as well. So we need to be aware of both. And so thank you for sharing that information with us. And hopefully we can get copies of your PowerPoint to put on the website, because I know there were a few questions about a couple of the slides. So maybe we can share that with our attendees following this session.
Absolutely. I saw a couple of questions, a couple of comments about showing the teenage slide again, and menopause specifically. Where's my menopause? There's this one again. I didn't mention oral thrush. That's actually a Candida albicans infection, which is a fungus. And sometimes it might be like that white plaque that you can brush off on your tongue or your cheek. And usually you'll need an antifungal medication such as nystatin. And that's really has to do with the dry mouth specifically.
Well, thank you again. We appreciate your being here today and sharing your amazing careers with us and providing us with a lot of food for thought.
Oh, you're quite welcome.
Thank you, ladies.
So
it's our pleasure. Thank you, everyone.
Thank you.
So for those of you who were able to spend a better part of your day with us today, I hope you enjoyed the program. We kicked off the program with a multi-generational panel that provided some amazing best practices and practical career advice from a variety of generational perspectives that I hope will be useful to you as you pursue the next move in your careers and how you can approach it. And then we were really gifted with the candor and advice, truly amazing advice that Tanya Angie provided about moving the needle for women in this profession, and not just advancing our careers, but it means being mindful of the need to maintain balance and integration in our lives and in our work through self-resilience and self-care and the ability to sustain mental and physical health and well-being. And we gave our minds and bodies a guided break through Cigna's Climb podcast and learned that mindfulness breaks can be easily incorporated into everyone's busy schedule. So remember that when you're feeling stressed. Thank you all for taking time out to spend this day with us as we explored bold women and bold changes that affect our lives personally and professionally. And thank you to ICMA, who will provide a recording of today's event that will be available on the website soon. Finally, happy International Women's Day on Friday to all of you. And find a way to celebrate National Women's History Month and support this year's theme, Women Who Advocate for Equity, Diversity, and Inclusion. Have a great rest of your day and be proud. And share with everyone everything you've learned as women leaders in your organizations. Take care.